Welcome back, guys, to episode 23 of Scrubbed In. Today we're discussing the angry, aggressive patient that almost every doctor will come across at one stage. So Abdul, let's start off with the stories, why don't we? What angry, aggressive patient you come across? Go on.
I'll talk about the most recent one, because this one, it was an aggressive patient and it caught me off guard. So during my last block, so I was on Obs and Gynae, we run gynae clinics, right?
Yeah.
So we had a lady, so the gynae clinics naturally in this country are really busy. We're seeing like 30 patients in the clinic, and it's just me and another doctor. So it was me and the consultant, right? So we're behind naturally, and the waiting time was more than an hour. So naturally people are already like proper annoyed. So what we do is we get the notes, we review the notes, we speak to the patient, and then we go to a consultant, we discuss it, come back, put a management plan in place, right? Standard practice. So that's fine. So we're doing it one by one. And one of the ward clerks or the receptionist was like, heads up, doctor, we've got a really angry patient, really upset patient. And I thought, normal, it's fine. We know how to tackle that.
Yeah.
And then she goes, we've really had to move her to a side room seat, refuses to be in the waiting room with everyone else.
What, because she was waiting an hour?
Yeah, she was so annoyed and proper like...
She hasn't been in any...
Yeah.
Okay.
So she got her own little waiting room, and that already is a bad sign. So you have to imagine how bad a patient is popping off.
Exactly, yeah.
So then I thought, all right, cool. Once I finish with this patient, I'll grab the notes and then bring her into my room. So the doctor's like, yeah, thank you, really. And he was like, can you do it to me as a favor?
Do what as a favor?
Just see this patient quickly, innit?
Cool.
Yeah? So I've got her notes, right? And by the time I finish reading the notes, she knocks on my door and I bring her in. And the first thing is, you introduce yourself. Hey, my name is X, Y, and Z. I'm really sorry for the wait. Do take a seat, whatever. Man, as soon as... So she was angry and she was with her friend. So that's fine. And my practice is, if it's a patient I've never met, so this is the first time I've met this patient, but she's a follow-up patient. So she's been in our clinic 2 times before. So I usually say... because it's the first time I'm meeting you, do you mind telling me what's been happening so far from your last visit, or just give me a bit more background? She went ballistic. She stood up and she goes, what? You've got my notes. You're asking your notes. Me.
They always say that.
She goes, you got my notes there and you're asking me what? And so I'll tell you when it got worse. She's like, you're asking me this, you should know everything. She goes, what's the plan now? So she said, what's the plan now? So she had an ultrasound scan. And I can't even remember what the scan was for. So she goes, what's the plan now? Tell me the management plan. I've been waiting for an hour, and you're asking me here. And then it took a bad turn. So she was being aggressive. Then she's like, you're an incompetent doctor. What's wrong with you? You don't know anything. She's going, so she's questioning it, innit? Yeah. And that caught me off guard, innit? So I'm trying to calm her down. I'm like, I apologize. It's only because of the first time I'm meeting. It's kind of nice for me to understand what's happening. I'll have a look at the scans and I can always consult with the doctor. She's like, so you don't even know what you're doing, you need to go speak to someone else, why are you even doing this? Then I said, listen, your consultant is here, I can go grab your consultant. And she is like, what do you mean? She's just having a go at me, and then her friend kicked off. Do you know what I mean? So it's just 2 against 1, right? And naturally I'm not a big fan of these situations, innit? And as a medic, you always have to be on the back foot. You have to always be at their service. So I'm already off guard, and I'm kind of now at the point where it's getting intimidating for me. Do you know what I mean? And I'm being overwhelmed. So I thought, do you know what? Let me escalate the situation. So I thought, let me call the consultant and then he can come. So I went and grabbed the consultant, and the consultant was with a medical student, and he's like, yeah, chill. Let me see this one. And I said, nah, you need to come ASAP. She's been really angry. She's kind of swearing. And I can't, so I said to him, I'm not going back into a room by myself, innit? I need to go in with you. And he's like, oh my days, you're actually scared. I was like, yeah, she's going to bite my head off. She was going to bite my head off. So I went with him. And as soon as he went in, and bear in mind, he's a consultant that has been doing this for 30, 40 years. She went ballistic at him. She goes, what is this, whatever. And you know what I rate about him? You know what he said? He said, don't you ever dare be rude or aggressive to my junior. Yeah. He's only been here a week or two. Man. But take it out on me. And that day, the amount of respect I had for him was amazing. He said, don't ever be rude to him. He's just a junior. He's new. Take it out on me. You can be rude to me, but never be rude to him. And she's popping off, and he's a very smart doctor. He basically still did the consultation while calming her down. So obviously we safety net, make sure there's nothing wrong. And then he's like, look, I'm going to write it to her GP, explain what happened. And she's just gone ballistic. And obviously, for me, there's a difference between being aggressive and angry, and then there's using foul language, questioning competencies, knocking me and the consultant. And he's like, do you know what? I'll deal with the consultation. He did it. And then it kind of went into like a formal investigation because she became abusive. The one thing is, sometimes patients are not as abusive to doctors as they are to other members of the team. So the admin people and the nurses get it a lot more because there's always that barrier. And she was shouting, screaming down the corridor, and everyone was a bit shell-shocked, I think. And they came and apologized to me, and they're like, yeah, sorry, doctor, we didn't realize, would have gave us to the consultant. So that was my most recent experience of a really aggressive, verbally abusive, intimidating patient. And I find it very difficult to handle that, and it kind of hit me, do you know what I mean? And you keep thinking about it, and you kind of reminisce and ponder in your head, and that kind of murks you for the rest of the day.
It does.
And obviously you get over it, and the consultant was really apologetic, man. He's like, because he's very supportive. And he's my supervisor as well, and he supported me. Do you know what? He's amazing. Like, he proper sorted it out, de-escalated the situation. But man, it was a rough time.
But yeah, so
that's mad, isn't it?
For over 1 hour wait, I'm just thinking in A&E. Oh my god! So I've come across loads of situations. When it's one-on-one, you do what you do, de-escalate, isn't it? And we'll go through how to de-escalate a scenario. But in A&E, waiting times go up to 6-7, and people become like
6-7 hours. Say that
6-7 hours, and they become like mobs.
Wow.
Like they'll start like rioting in the waiting area. There was this one funny incident though. So you have to remember, it's like 4 or 5 a.m. All night long. It's been like a 7-hour wait. We've been having to run around, make sure it's a safe environment still. Anyway, so this one young guy, he's just literally been booked in and waiting, and he comes and he goes to me, "Yo, big man, how long am I waiting for?" And I sort of said, "You'll be waiting for 6 to 7 hours, sir." And it goes, "Rah. Fam, I'll wait though. It's important." So I'm like, "I'll see you soon. I'll see you hopefully soon, or one of my colleagues will." And the thing is, he said it in an area where there's loads of people waiting. They've waited 5 or 6 hours already. Yeah. And then one by one, all of them are like, "Hey doctor, I've been waiting 7 hours. When am I gonna be seen?" "Hey doctor, I waited 6 though." "Hey doctor, I waited 4." And all of them just started to have a go. And then one of them really got aggressive and stood up and went to me, "I've been waiting 8 hours and I've not been seen yet. When am I going to be seen?" By the way, a lot of people exaggerate. They say they've been waiting, that when you looked up on the system, they're 2-3 hours only. And she was really like in my face. And you know when you reach that point in the night shift when you're not going to tolerate it, and I just went to her, "Madam, I cannot stop time and I cannot see people at the same time. There's one of me and there's 50 of you." And then I was like, so I literally just looked at her and I just said it like that. I've got red eyes. I've got discharge coming from my eyes. Yeah. And she said, "Well, how many doctors are there? Like, why can't you just see everyone?" I was just like, "Madam, if I started from this side, it would still take me 1, 2, 3, 4, 5 patients. It takes me at least 45 minutes to an hour to sort out one patient at a time from seeing them to treatment." Yeah. And anyway, she just went off on that, and she just went, and then the next patient went, "I'm waiting for," so she was already seen by any doctor and she's waiting for a bed. And the thing is, during the winter crisis, we're like minus beds. There's no beds. We're waiting for discharges.
It's really bad.
And she was like, "When am I waiting for a bed? I've been here for like 15 hours. I should have gone to the wards by now. What is wrong with you? Are you guys incompetent?" I just went, "Madam, I'm a doctor. I can't build a bed." And I just walked off.
Savage, man.
I can't tolerate it at 4 a.m. It's just because obviously it's in front of everyone. But you're right. When it's one-on-one though, you don't do that, because otherwise.
Yeah. Because the problem is, for us, or that situation, I was in a room, there's 2 of them, it's me, plus it's my first week on the job, or 2 weeks on the job, and I'm straight in the middle of a gynae clinic, which is super busy. And the worst thing is, at least you know where to stand. Here, I lost my bearing, I lost my ground, and that's the worst place to be, because if it was on the wards, you calm, you know how to tackle it.
Exactly.
But when in a new environment, in a new job, and they're in your face, and they're questioning your competencies, and in your face, and like, that's when it kind of caught me off guard. Just catches you off guard. I'm not one for this conflict situation. I'm like the biggest hype man in it, but that time I was caught off guard, and I'll admit it. Any other situations?
What other situations? No, so there are a lot similar like that. You just get people saying, "Why am I waiting? Why can't you see me faster? Blah blah blah." And every time in A&E especially, I've noticed when you take the patient to see them, they'll always comment, "Oh, I've been waiting for so long." And I always say, I'm sorry, I can't do nothing about that. I'm sorry, I can't do nothing about that. I've said that line so many times. Who have I thought of who came across? Has anyone come across? You know what? You beat anger with just a smile on your face.
Yeah.
You smile and you just give something.
Yeah.
So just reply something quirky, like the way I just said, I can't build a bed.
Yeah.
What do you say to that?
Yeah.
What do you say to a doctor who has said they're a doctor and they're not someone who can build a bed?
I think that's what it is.
You
I
get
think
it?
on the whole, the vast majority, 99% of patients are really nice. And I get the frustration. You know, you're waiting a long period of time, you're rushing, you know, getting time off work is difficult. So I appreciate where they're coming from. And it's disarming them, essentially.
Exactly.
It's like sometimes they expect a, you know, reciprocation, or like they expect you to kind of stand up to them or whatever, and, you know, get into the point of fighting. But once you like soften the tone or de-escalate or smile or do something, it does help a lot. Or it's like, okay, fine, I apologize. Sometimes I just want to hear something, just that someone knows they exist, someone that cares. I remember once I had a gentleman on the wards, right? He was 70 something, but he had this UTI and cognitive decline, and he was taking a really long time to go back to baseline, right? And he wasn't doing too well. And I remember there was a question on his DNR, right? For resuscitation, or essentially if the heart stops, do we go and do chest compressions? And basically when a patient is really unwell and we think that, you know, they're deteriorating, they're not doing too well, we've done what we can do. He had a bleed in the brain as well, by the way, yeah?
Okay.
So a subdural. So my consultant was like, do you know what? Speak to the family and, you know, kind of talk about DNA, to kind of put in a form into place saying that he's not for resuscitation, the outcomes are worse. So I called up the son and I'm kind of having this conversation, and bearing in mind on the discharge letter is already, he had one in place in it. So we're just confirming it, following, just doing our due diligence. Man, he went ballistic. I don't know what I'm saying. On the phone, you know what he was saying?
Yeah.
He's like, you doctors. So the worst thing is like, he's like, you doctors, you know, want to kill off my dad, you know, I've seen
It's a misconception. Yeah. We need to discuss that as a topic as well. Yeah.
So we should do that. The misconceptions of doctors, what DNA means or whatever. So he's like, you want to kill off my dad? You're ageist. You're discriminating him. And in medicine, there are certain buzzwords when you hear, you shut down. Like, I'm not here.
Walk away the opposite way.
Discriminating, bullying, patronizing. These are words you do not want to hear as a doctor. Yeah. So he's like, you're discriminating him. He's my dad, and he's like, all he needs is IV fluids and antibiotics. I'm explaining to him, look, elderly people, after one hit, you know, by the time they recover, they take another hit. So they can never really fully recover to baseline. And I'm telling him this is a discussion. He's going ballistic. He's like, right, I'm coming in. He said, I'm coming into the hospital. I'm going to deal with you. That's what he said to me on the phone.
I'm running. I'm running.
Bro, he said that. He said, I'm coming to the hospital. I'm going to deal with you properly. I thought, game over. I'm finished. So I ran to my consultant, yeah. You know what my consultant said, yeah? He goes, we're going to do role play right now. So he takes me to a room and he goes, this is how you do the role play. My consultant is the medical director of the hospital, yeah? So he's a boss. He's really good, by the way. And he's like, this is what we're going to do. And he went through the whole situation, yeah? And he did a whole role play. My role play didn't work. When the sun came in, he turned the woods upside down. He was fuming. He was angry. He went ballistic at me. He went ballistic at my reg. He went ballistic at my consultant. He went ballistic at the nurse. No one could control this guy, and he was a big chap. Yeah. And I get where he's coming from. It's like basically what happened was, last time someone put a DNI in place and his dad fully recovered, went home. So, and like you said, they think when you put a DNR in place, it means we cease treatment. We cease. So basically, he thought we're taking away the fluids, we're taking away the antibiotics, and now we're going to send him home. That's what he thought, right?
Did you guys not just tell him?
No. So, the question was, before I could even tell him, before I can open a conversation, he put one and one together and went.
It just went one way,
So my thing was, hey, do you know what? XYZ, I'm calling from Finger Hospital. We want to talk about your dad or whatever. And we want to talk about this. Last time it was discussed about there's no documentation about it. And as soon as he heard that, it triggered him. And he went ballistic. And my concern for he's going to prep me up. We both got rinsed. And you know who came and saw the situation up? It's his sister. So the brother's sister, so the daughter, she came onto the wards and she basically, it's his older sister, she gave him a telling off in the wards. So imagine your older sister coming and she goes, how dare you these doctors are looking after dad, and you know what's happening. And he's like, we already discussed this and you agreed with it. I don't know why you're going back on your word now. And he's like, oh yeah. So once he kind of understood what we meant, he's like, oh yeah, I'm happy with that. And then the funny thing is, once they realize, they feel a bit embarrassed. Do you know what I mean? Because they've done one thing and they feel embarrassed. But then it's lighthearted. You kind of take on the chin. But I remember that guy, and I thought, when he said, I'm coming to the hospital now to deal with you, I thought I'm going to get beaten up. And I ran to my consultant.
You're wearing your helmet and your armor and everything.
But it's good. Like, it's a lot of times, aggressive behavior comes from misunderstanding, misconceptions, frustration, waiting, and naturally, if we are in that situation, we'll probably do the same.
Yeah, exactly.
So those are two things I remember. All the rest are fine. Patients are lovely, but those two are like stuck in my head.
Cool. So why don't you give us some advice on how do you de-escalate
So I think
a situation? Tell us. So for our medical student population, especially for the guys that are watching, and they want to know how to deal with an angry patient.
I think
what advice do you give?
The key thing for us, and Kings does it really well, is identifying a patient is angry. Identify if a patient is upset, identify if a patient is frustrated, or if they're really aggressive and angry. Once you identify what you're dealing with, now you need to think, all right, I need to de-escalate. So I think the main thing is, once you've identified that you're dealing with an aggressive or an angry patient, communication is the first thing. You drop back, you drop your tone, and you try, basically, you soften it. You're like, I understand. And it's key buzzwords. Like, you want to use, I appreciate you're angry, I appreciate you're frustrated, I appreciate you're angry. They might be standing, so you are supposed to kind of say, let's take a seat, let's try to figure it out, let me get you a cup of water, let me give you a moment. And it's the tone and the choice of words. And they say never use words like, I understand where you're coming from, because you can never really understand.
That's true.
It's more, I appreciate where you're coming from, I appreciate your frustration, what would you like, let me help you. So now the main thing is, you forget the rest of why you're here, what's your presenting complaint, where's your pain. It's more like calming them down. So,
and how can you solve
their problem? So now you have a new problem. How do you solve that problem? And it's adjusting your communication and understanding them being angry, and kind of responding to the anger is obviously the tone, choice of words. Do you need to escalate? Do you need to bring seniors in? Do you need to give them a break? Do you need to step out of the room? And I would say the most important thing in all of this is protect yourself, because patients can become aggressive. Patients can attack you. It doesn't happen, or I don't know how often it happens, but protect yourself at the end of the day. Never put yourself in a position where you're vulnerable, and never put yourself in a position where you are being bullied. At the end of the day, we're there to help them. There is a fine line, and I'm about that fine line. Anything else?
No, so I think you've summarized it in 3 ways to de-escalate. So number 1 is, as you said, recognize that they're angry and show them that you recognized it, okay? Next thing is adjust your communication, as you said, choice of words, your tone, how you say what you say, okay? And then working together to now solve this new issue that they have. So I think you've actually summarized it very well for anyone that wants to take on some advice on board about how to de-escalate. Now there are I'll add a few things on what to avoid, right? And that's quick fix recommendations. Oh, okay, fine, we'll do this then, and this should solve your issue, right? That seems like you just see their problem as just something very small that can be fixed like that. So I think you need to avoid quick fixes.
It's true.
Number 1, avoid getting angry yourself. When it's 4 a.m. at night, you're on a night shift in A&E, it's very easy to become pissed off yourself. So to be very careful of getting angry yourself. Realize what you're feeling inside as well. Acknowledge what you're feeling, and make sure you keep a hold of that, control of that. I think they're the 2 main things that I'd say you should avoid. And there you have it. They're the rules and tips and tricks on how to de-escalate an angry or aggressive patient.
So I think today's episode is like totally different. So we've kind of talked about some of the experiences we had, but more so kind of how to de-escalate a situation. Different things work for different people. especially at junior level, you do have seniors that you can go and call for help. There is support. Don't feel like you have to kind of bear the abuse, bear the brunt of an angry patient. It's not nice. We've been there, and if you haven't been there, most probably you will have the experience. And it's the same. It's not just medicine. It's in every situation. These are techniques and tips you can use to de-escalate a situation. So let us know if you've had these situations, what you've done, what works, what doesn't work. We're more than happy to learn from you guys as well.
Share your stories in the comments below. Share your stories on coming across angry patients. Even as a student, we all come across angry people in our field of work. So share your stories and tell us how you dealt with those situations.
We would love to hear from you. So we'll wrap it up here today. Thank you for listening. Make sure you comment, make sure you subscribe, spread the word, share with your friends, family, colleagues, and we'll see you next week.
See you then.